Now, our special series on soaring healthcare costs. A recent survey finds Americans have collectively borrowed about $88 billion to cover doctor and hospital bills, bills that can be confusing or even come as a shock. We've teamed up with the journalists at Clear Health Costs to shine a light on the problem and to help people fight back. Tonight, in our series, Your Money, Your Health, Anna Werner takes an in-depth look at the sky-high costs of medical price roulette.
There was no other way to go.
It's been a year since crippling back pain sent Frank Esposito to the doctor.
He looked at the MRI and he said, you need to go to the closest hospital immediately.
This 59-year-old tool and die maker from Long Island says he could barely move.
It wasn't an elective thing.
It was that obvious.
Yeah, it was that
obvious. You couldn't even walk.
Doctors told Esposito he needed immediate surgery, that a herniated disc in his spinal column threatened to leave him permanently paralyzed.
The pain was bad, and I never thought it would end.
But the surgery was just the beginning of Esposito's nightmare. He has private insurance, so you might think, as he did, he was covered for this kind of emergency. But just weeks into his 7-month recovery, the bills started pouring in.
This says the amount you owe is
$256,000. It's mind-boggling. And that's only one doctor.
Esposito was on the hook for over $650,000 in bills, including $256,000 for the orthopedic surgeon who fused his spine, $220,000 for the neurosurgeon, and another $53,000 for a doctor who monitored his breathing. He was denied coverage because his insurance company decided it was not an emergency and not medically necessary.
You say that this can't be real. I mean, I really don't have to pay this. How am I going to pay this? And you sit there and you start crying because you don't know what you're going to do.
Esposito's story is exactly the kind Americans fear most. 4 in 10 say they've received a big bill in the past year. It's all part of a healthcare system that has become more complicated and costlier, with out-of-pocket spending up more than 50% since 2010.
It is far too easy for these kinds of crazy stories to happen.
Erin Carroll is a pediatrician and health services researcher.
So many people feel like they are being pushed to the limit, that they are being ignored, that nobody is responding to them.
Yes, it's soul-crushing. I mean, truly, and it's the really bad part is that the people we're asking to do all of this legwork are the sick, and then we say, suffer a bit more, then it might get better. That's just not a good system.
Patient advocate Susan Null works to help fight her clients' medical bills for a fee.
This is an interesting case.
It's taken her more than a year to resolve some of Esposito's monster bill.
We had to prove that it was an emergency.
And this is the insurance company after the fact contradicting the doctors and deciding we disagree.
Right.
I mean, how often does that happen?
Unfortunately, like quite a lot.
Frank Esposito's taken $49,000 from his 401k to pay down some of his bills. He's even appealed to the state, but he still owes more than $220,000.
You need to be able to know that you can do this, that you're going to get the care you need, that you're not going to be destitute by the time you're done.
After appeals, Esposito's insurer, Oxford United Healthcare, paid some of his doctor's bills. We're still waiting for response as to that remaining $220,000 bill. Now, as part of this series, we want to hear what you're paying for medical procedures. Go to cbsnews.com/health costs and click on the link to share what you paid. You can also search prices in the 2 markets already surveyed by our partner, Clear Health Costs. That's Dallas and San Francisco. Margaret.
Important reporting, and it's going to be a key issue for voters.
That's for sure. A lot of people are naming this their #1 issue.
Anna, thank you.